Hey everyone, today we are going to discuss hyperacute graft rejection, a very rare kind of a graft rejection, but very important clinically. So please stay tuned and jot down all the key facts that we are going to capture. That is very important for your exams. What is hyperacute graft rejection? Here it happens within 48 hours, that is the cutoff. So beyond 48 hours, it will become acute rejection. So generally it happens within minutes to hours. Immediately after the graft transplantation, the graft will start showing swelling and signs of rejection will be quite eminent. And so here there is a type 2 hypersensitivity involvement. Remember, type 2 hypersensitivity reaction is seen. And here the immunoglobulin and the complements are activated, and that causes damage to the blood vessels. So where is the target? That is commonly asked. Where is the target of these antibodies? So these antibodies are going to react with blood vessels. That is the most important target. And here, as you can see over here, the target is on the blood vessels. There is a damage to the endothelium and there is a formation of thrombi. So it leads to thrombi in the blood vessels inside the lumen, and it will lead to the thrombosis of the graft. The graft will show thrombosis and infarction because of the blood compromise. The blood vessel of the graft is stuffed with thrombi. That is the important key facts in hyperacute graft rejection. Causes of hyperacute rejection, which condition it happens? It is rare, so it happens very rarely. It is a rare condition, but can happen when ABO incompatibility is there between the recipient and the donor. Multiparous women frequently develop antibodies against the paternal HLA antigens which are shared from the fetus. And now if the fetus or the or his husband or her husband basically donates the kidney, relatives donate the kidney to the woman, now there is a high chances of rejection. So that is an important feature. So here the antibodies are directed against the HLA antigen, and even prior blood transfusion can also sensitize towards that and can cause development of anti-HLA antibodies. So three conditions we discussed: ABO incompatibility, multiparous woman, and prior blood transfusion. So remember the three factors that are very important for hyperacute rejections. Clinical features: within minutes to hours, there will be graft rejection. There will be swelling of the organs as soon as the perfusion is restored, as soon as the anastomosis is being made, the swelling of the organ starts. Generally, within 30 minutes to few hours, it starts. And treatment, nothing you can't do. You have to do immediate graft removal. It is going to be catastrophic. Graft is not going to survive. Preoperative cross matching and ABO grouping has to be done properly, then it can be prevented. So let's have a quick recap to wind up this presentation. It is a hyperacute rejection is typically seen within minutes to hour. Less than 48 hours is the cutoff. And here there is a type 2 hypersensitivity reaction, and antibodies against HLA are being seen. And here it is due to prior blood transfusion, multiparous woman, and ABO incompatibility. These are the key features. And antibodies against HLA that typically causes damage to the blood vessels of the graft, causing thrombosis and infarction. And there are preformed antibodies because there is no time. Immediately the antibodies are there and it's gonna react against the graft that is transplanted and causing rejection. And a clinical feature will be immediate graft swelling and graft dysfunction. Treatment will be graft removal, and you have to do proper grouping and cross matching to prevent this kind of a rejection. Thank you. Please like, share, and subscribe, and also let us know what kind of a videos do you prefer. Please comment in the video, and be tuned to the next video. And also we are starting with 10 days crash course. We have already started that. Currently I'm offering to various students. So what I do in 10 days crash courses, I do offer personalized coaching. And here along with that, some recorded materials and some notes are being given. So it is intensive training. Pathology, whether you are preparing for your MBBS university exams, or you are preparing for NIT PG, you are preparing for USMLE, PLAB, FMG. So I offer personalized sessions that make you tune and make you ready towards your preparation. So if you don't have any time, if you are stressed up, Don't take the stress on your head, and just contact me immediately. I will be there right now to help you out, and I'll make sure that you come out with the flying colors. Thank you all, and we'll see you in the next video. Bye bye for now.